I'm warmly welcoming all the speakers and participants to the session Strengthening Health Systems Worldwide. What next for the EU Global Health Approach? My name is Vesna Kerstin Petric. I'm a director at the Directorate of Public Health at the Ministry of Health of Slovenia, and today I will be your chair. The reason why this session is in particular organized with the cooperation of Gastein Forum and Slovenia is that we are holding a presidency to European Union, and health systems are in the focus of our presidency. So now let me start with a short introduction of the session. COVID-19 has demonstrated unmistakably the importance of global solidarity in the response to common threats. No country is safe until everyone is safe, we keep saying. And dealing with this global crisis as well as future challenges calls for holistic, inclusive, and coordinated approach to health systems strengthening within and beyond European borders. On the other hand, we will not be able to talk about succeeding with SDGs if not all people will have access to safe and qualitative care, including preventive services throughout the lifespan and close to where they live. This session is organized under the Slovenian Presidency to the Council of European Union to discuss how the EU can contribute to building solidarity, innovation, and resilience in health systems worldwide. Today, we have with us important presenters: ILONA KICKBUSCH, Josep Figueras, Agnes Binaguao, Meera Dashich, and Mike Dunbir. I will present all of them when they will speak. But let me, at this point, invite you to share your comments, dear audience, and questions in written in questions and answers function that you can find below your screen. We will come back to your questions in the panel discussion at the end, and I hope everything you will ask will be answered. I would also like to remind the speakers, of course, that we have to keep time, and by doing so, allow enough time for discussion. Every speaker has 5 minutes. But now let me introduce our first speaker, ILONA KICKBUSCH. ILONA is a funding director and chair of the Global Health Center within Graduate Institute for International and Development Studies in Geneva. She is also the vice president of Gastein Forum. She has supported the Global Health Initiative in several consecutive presidencies to EU with her knowledge and expertise in global health as well as health diplomacy. ILONA is also supporting Slovenian presidency and has many other assignments in this time of crisis. Therefore, she has recorded her presentation for us ahead of the session. Let us now listen to what she wants to share with us on the role of EU and on EU initiatives in global health.
Good morning, ladies and gentlemen, dear friends. I'm very happy to address you in this very important plenary that is taking place. The European Union has become, as you know, a strong and important player in global health. But, as we also all know, it could do better. The pandemic has been a wake-up call for better cooperation between European Union countries, stronger EU mechanisms and institutions, stronger partnerships globally, and stronger support to multilateral health organizations. In her State of the Union address, the Commission President Ursula von der Leyen reported on the contribution the European Commission had made to fight the pandemic at home and abroad. For example, the support to Act A and COVAX, the delivery of 7 million vaccine doses to the rest of the world, the plan to now invest 1 billion to ramp up the mRNA production in Africa, and a commitment to share another 450 million doses globally. She did not mention whether the European Union would change its stance on the TRIPS waiver at the World Trade Organization. But can these commitments be maintained? On the one hand, the European Council President Charles Michel has suggested a global pandemic treaty to bind countries to work together systematically to prevent and respond to pandemics. On the other hand, the Commission has taken the first step for a vaccine agreement between the United States and the EU. But there was strong hope for strengthening a number of European institutions like the European Centers for Disease Control, the Medicines Agency, and to build a new strong institution called HERA. But it seems that now this will not be approached with the game-changing strategy that was originally planned. It seems countries are no longer willing to boost the European Union health powers. The Commission President has now promised a new health preparedness and resilience mission for the whole of the European Union, backed up by an investment of 50 billion euro by 2027. But what is not yet clear is Europe's global health strategy beyond the pandemic. For example, its intersectoral dimensions. How will Europe, as the world's largest trading partner, support health in its trade agreements? How will it link health to the European Green Deal and the planetary health agenda? And what is important for the meeting this morning, how will it strengthen its health systems dimensions? How will it support low and middle income countries in building strong public health and healthcare systems, including support for a global health workforce? Probably this will be the most important investment to prevent future pandemics. How will the European Union take forward new partnerships for building such systems, for example, through the Europe-Africa Partnership and the Neighbourhood Programme? Both will be discussed this morning. While the focus is on vaccine equity right now, this will define much of health futures. There is a clear understanding globally that we need resilient health systems in Europe and globally. The political declaration on universal health coverage and the Astana Declaration have said this clearly. Many EU programs can contribute to this, such as REACT EU, the Cohesion Funds, Invest EU, and the Neighbourhood Development and International Cooperation investments. This will be significant investment, but it needs a clear direction and a strategic intent. It must be ramped up and become a policy priority. In consequence, it needs a strong European health union with strong mechanisms to promote not only health security, but resilient health systems. It needs a strategy that commits to building such resilient health systems and puts everyone around the table to move that forward. It needs strong Council conclusions that provide the necessary political support. This is a call to present and upcoming presidencies. It is excellent that Slovenia has put resilient health systems on the agenda. And it is brilliant that this is also being discussed here in Gastein, not only in its European, but also in its global dimensions. Thank you very much.
ILONA has shared with us how much is already going on, and she has also so well pointed to what we have to do in the future if we want, in fact, to strengthen our health systems and make them more resilient. There is, of course, more than just being resilient to diseases like COVID. We also have a huge burden of non-communicable diseases, and also here we must work together globally, and we have actually aimed to working globally in this regard in the past already. Let me now introduce Josep Figueras, Director of European Observatory on Health Systems and Health Policies. He himself and the Observatory have contributed immensely in the last almost 25 years to global understanding of health systems, the challenges they are confronted with, and evidence-based solutions. Joseph, my dear friend, the floor is yours.
Thank you. Thank you very much indeed, Vesna. What a pleasure to be here today. You asked me, however, a difficult job, Vesna, as always. You keep the difficult ones for me. The question I have is, in what ways does the EU help to strengthen health systems around the world? So I want to look very briefly what's happening, and particularly looking at where we move it next, building on what Ilona has said already. So it's going to be a true lightning talk, if not lightning, fast one, if not enlightening. The perspective here is not going to be, for the first time perhaps in this conference, around the pandemic, the vaccine, the International Pandemic Treaty, which are core fundamental issues we've been discussing. I like to talk about horizontal health systems and strengthening. And I want to be more constructive, perhaps, about the role of the EU. So a lot has been happening, a lot has been doing. And what I like to start at the beginning, we've been talking a lot, you said it, Vesna, again and again, no one is safe until everyone is safe. And you, Vesna, said it. It's not just about the virus, it's not about communicable diseases. Health systems strengthening is key to that safety. It's key. If health systems are solid, are sustainable, societies and economic development is sustainable. If health systems are strong, they'll be able to deliver all these vertical programs that we are financing now. So in part of that safety, in being all safe, we need to ensure that these health systems in other parts of the world are also very safe. 3 points. First, the current support. The current support at the moment is broad, is large. Here, Vesna, I'd like to encourage you, perhaps, as part of your presidency, the same way that you've been doing with the Observatory, this map of the various programs to support health systems, to encourage you to look at the wide range of programs that are out there and directorates supporting global health, directly or indirectly. DG NEAR, DG INPA, Development Aid and Policy, it's the largest single donor in the world, 50 billion per year. Team Europe contributing to COVAX and the commitment to access to COVID-19 tools accelerator, ECHO, humanitarian and civil protection. So the first thing here is there is a wide range of very effective programs that, however, we need to understand how they link with each other, how we build more critical mass between them. Second point, Vesna. The second point is, while we need to revise and update the current global health strategy, which was from 2010, together with the Council conclusions, many of the elements, it was a milestone, and many of the core elements of that strategy are still valid. And if anything, one of the lessons is, how do we implement those core elements in that 2010 strategy? Very good news, as Ilona said, that many of the presidencies, Slovenia, Portugal, and the next two ones are going to be focusing on global health, and it's a great window of opportunity to look at the new strategy. But what is next in that strategy? As I said, in this new strategy that we're working on, I think we have to maintain some of the elements of the old one, because if the old one did not fully succeed, was partially, as in many other areas, colleagues, because the member states and the political will to support that EU strategy hasn't been quite there. When we talk about EU support, EU strategies, we have to differentiate the EU as a whole and the policies of the EU member states not always align with the EU policy. In this particular area, and as we look at the new strategy, we see how member states pursue their global health strategies in parallel to their participation to join EU actions. So the aim here is to have a common voice and build critical mass of all these bilateral agencies having fundamental support to parts of the world on health systems that sometimes are not singing the same music with the EU programs. So coordinating and harmonizing global health systems policies, member states' support to global health systems policies will be fundamental. Second, I already said that, and I think the philosophy of the Slovenian presidency about looking at the tools to support health systems should also apply to the many DGs, the many programs in supporting global health in trying to coordinate and build critical mass within the EC itself. Third, very important, there is limited internal competence on health provided by the EU treaties. So that influences as well the ability of the EU to exert external influence on health systems. So we hope that with the European Health Union, although Ilona was saying she was not as optimistic as I am perhaps, but we hope that with the European Health Union initiative gives us a real boost for the Commission, for the European Union, to have more support to these global health systems policies. I'm wrapping up, Vesna, just with a few points about what I think are the core elements that we need to continue strengthening and building on the new health strategy. First, continue with the strengthening the global partnerships, support to the WHO leadership, to the Global Fund. Second, joint ventures. We'll hear about the Africa-EU partnership. There are many others, such as the European Developing Countries Clinical Trials Partnership, which has been particularly effective. Continue with this idea of building capacity, promoting research, investing in development of new health technologies and national production of these technologies. And finally, Vesna, horizontality. There are a number of vertical programs, but still, horizontal and vertical has been one of these issues that has been there forever since I've been working on health systems. We need to continue, which was in the first strategy, strengthening the health systems and reaching UHC. The fact that Europe, this continent, the European Union, is leading on UHC, on the values, can be really a leadership to support other parts of the world on UHC. And again, UHC is part of sustainability, and if everyone is safe, we're all safe. Primary healthcare, this continent has made major strides. We're talking with Slovenia here, which has some of the best experience in the region in very cost-effective primary healthcare. And finally, in this new strategy, human resources. It's there. I want to continue strengthening that. Empower and train frontline healthcare and social workers, and particularly the support to the global code of practice, which was actually in 2010, very much at the same time as the new global health policy for the European Union. And again, we have to be a bit positive there. We've been looking at that, and there's been a decrease in the numbers from low and middle income countries. There is an increasing adherence of our EU member states on the global code of practice. There's still more to do, but there's been really decreases in the numbers of professionals that have been taken from those countries and undermining their own sustainability. That needs to be a core element on this new global health strategy. Thanks a lot, Vesna. Back to you.
Thank you, Joseph. Thank you for giving us such a good insight of existing mechanisms, the challenges, and even opportunities for how we could actually act better globally as EU to support strengthening of health systems. But we all understand, I think, that we can, as EU, not do much if we are not doing this in partnerships with other organizations globally and with other countries and regions globally. So I'm really happy that I have here with us Agnes Binagwao. She's from Africa and is co-founder and vice chancellor, as you already mentioned, at the University of Global Health Equity. Agnes, the floor is yours. We would be delighted to hear how you see what we try to do in Europe from your perspective.
Thank you, Vesna, and thank you for having me. I want to recall history because we need to remember the past to understand where we are today and where we can go. Africa and Europe share a long history of 400 years of unequal relation, from slavery, colonialism, and now politics, education, migration, economic trade, brain drain, etc. From the colonial era, with the promotion of direct form of structural violence through international medicine and ethical medical and research practice, that was done at the benefit of Europe. And it has also destroyed our ancestral medical knowledge and heritage. From the two last decades, the African-Europe partnership has positively evolved Several times it was supposed to stop the past paradigm of donor dictating to the recipient what to do with little say for Africa concerning decisions taken in European cities. However, after these strategies were approved, many European member states still continue partnership the exact same way, instead to implement partnership in which Africa was an equal partner and also with sustainability in mind. Also, some vertical program or nutrition programs such as food aid, model that create dependency effect for the recipient, that impact local food price and consumption market, and most of their budget is used to pay staff that manage this large-scale project without sustainability. Creating a legal framework to fight brain drain or to fight all those problems is key. There is other failure demonstrated today now. There is a lot of good voice for goodwill, but there are failures, like the crisis we live with COVID-19 and the EU not fulfilling its commitment for initiative. On contrary, having an unused additional 900 million doses in stock. So far, European Union countries have in their stock what they need to vaccinate 2 to 3 times their entire population, with vaccine expiring in stock and destroyed since July this year. This has contributed to empty the market of vaccine doses we could buy from and that are not available. And we can compare this to Africa, which has only 3% of its population vaccinated. There are no vaccine available on the market, and when there are, preference is given to rich countries, even if Africa pay first. So European countries simply continue to stock vaccine, do not use them. This reflects selfishness in partnership and shows that between colonial time and inequity of today, a lot need to change. We know that it's not COVID, which is the cause of these inequities in our partnership, but COVID-19 has dramatically highlighted it. We need to work even more to achieve equitable, respectful, and sustainable partnership between Africa and Europe. For strengthening our system, this includes helping Africa to self-sustain, to manufacture what Africa needs to care, to diagnose, and to treat its population. Support health system with the respect of the 3-1, one governing body per country, one plan per country, one monitoring and evaluation plan per country, decided by the people in the country. And if it's the continent, decided by African Union General Assembly of Head of State. So support coordination, integration, self-determination, avoid horrible behaviors such as hoarding vaccine when people are dying, and also avoid to block manufacturing of what Africa needs to save its population from death. All this needs serious change in partnership, new international regulation and behavior, and also accountability in current multilateralism, because multilateralism where people can do whatever they want because they are strong players will not change anything, Vesna. Thank you.
Thank you, Agnes. Thank you so much to share with us your views on the impact of existing processes and practices in cooperation between Africa and EU. We should be aware of this, and I'm really thankful for you to boldly present all the challenges, but also giving some possible solutions to us to discuss and consider. I think there is a lot to be learned, as I understood from what you have presented, but as said at the beginning, I think in partnership, we can do this much better. But what does partnership mean? This means talking and listening. This means really working together as equals. And I think you pointed to this, and I think this is a very important message of today. And we'll hear more about this in the discussion later. But let me go to the next presenter today. Meera Dashich, head of Secretariat at the Southeastern European Health Network. Southeastern European Health Network is a well-functioning network of Western Balkans, where we have already been able to demonstrate how important can be the partnership of EU member states and other states in our European region in the area of health and in strengthening health systems. Meera, please, the floor is yours.
Thank you, dear Vesna, dear colleagues. It is my great pleasure to be with you here today, although only virtually. Times of need always show that solid partnerships are the force that drives the action. The impact is always greater when we do things together. This is particularly relevant for small countries and the region of the Western Balkans. The Western Balkans as a large part of the Southeastern Europe and in the immediate neighborhood of the European Union highly value all European Commission efforts aimed at achieving the highest possible standards in health among all other areas. The European Commission helps strengthening the health systems in the Western Balkans in two ways: on bilateral basis with individual countries and by using a larger platform through the Southeastern Europe Health Network. Southeastern Europe Health Network is the only organization in the area of health in the Southeastern Europe region and is the ideal platform to channel expertise with a greater outreach in the region and by working with the governments directly, thus perfectly aligning to the needs of the countries. In addition, two member states of the Southeastern Europe Health Network are EU member states, and another two EU member states of the Southeastern Europe Health Network are partner countries, among which is Slovenia. These EU countries foster the South-to-South knowledge transfer and expertise tailored to the Western Balkans needs. The preferred instrument used by the European Commission with Southeastern Europe Health Network is TAEX, the Technical Assistance and Information Exchange Instrument of the European Commission, mainly focusing on the knowledge transfer, sharing of best practices, inter-countries exchange on common opportunities, challenges, and immediate neighborhood partnerships. Over the last 4 years, expertise has been provided for strengthening injury information systems for road safety, scaling up colorectal cancer screening programs, and nursing working time, threats for health and safety in Southeastern Europe Health Network member states. Just yesterday, we finalized a TAEX multi-country workshop where over 140 participants from the Southeastern Europe Health Network member states, plus guests from Turkey and Kosovo, have been widely sharing their experiences and discussing the implementation of the single emergency number 112 for coordinated and fastest possible response in emergencies. The current pandemic, natural disasters, and other crisis situations call for better management of emergencies for our citizens. In the pipeline for the next months of implementation are how to cope with non-communicable diseases by strengthening and upgrading the capacity of nursing and midwifery workforce. Then guidelines on best medical practices to improve quality of effectiveness of reproductive health care for patients in the Southeastern Europe Health Network member states. Interventions and policies on antibiotics use in view of the raising antimicrobial resistance and the implementation of the One Health approach in the Western Balkans and beyond, and non-communicable diseases population-based registries in the Southeastern Europe Health Network member states. Moreover, areas as mental health and human rights and mandatory versus voluntary certification accreditation are still under negotiations. Thus, to conclude, the EU support in strengthening health systems in the Western Balkans and beyond through the Southeastern Europe Health Network focused on countries' interoperability and individual needs. It is a major advantage to know how are you doing, what are your neighbors doing, and the state of the art in the European Union, and how you can accelerate your achievements and reforms. Finally, I wish to underline that partners were always cherished and valued by the Southeastern Europe Health Network. Since the establishment of the Southeastern Europe Health Network, that this year turned 20 years, we acknowledged and promoted that only together we can generate something more than just pure mutual help, but an added value of great work and long-lasting friendships across Europe and beyond. Thank you for your attention, and over to you, Vesna.
Thank you very much, Meera, especially for these last words. Slovenia, yes, has been a partner in this network, not a member, but a partner as a EU country. But I have to admit that working in partnership with the network, we have learned a lot, in particular in the mental health area ourselves as well. So not we have only given you some good practices and shared with you what we have developed. Also, we have learned from you about practices, in particular, as I said, in mental health, but also we have learned how much faster we can implement innovation if we work in and network between several countries. This is also, I think, very important to understand. Now I have the last speaker, Mike Dunbir, Director of Strategy and Advocacy from Movendi International. When speaking of health systems, we should always keep in mind that nobody should be left behind. Healthcare systems have an important role in assuring preventive services to population, in particular to those most vulnerable. In doing so, the NGOs working in local communities have a specific role and should work hand in hand with healthcare services. I'm now inviting Mike to share with us experiences of Movendi International on how to best join capacities to address an important risk factor such as a harmful use of alcohol. Mike, please.
Thank you so much, Vesna, and good morning, everybody. It's a real honor for me to be invited to participate in this important event, and I also want to congratulate the EU Presidency of Slovenia for putting public health and global health as such a strong element of the EU presidency. So this is, of course, an important topic for us as well, and I'm really inspired listening to everybody. In German, we have a saying, a proverb that goes something like this: Man sieht den Wald vor lauter Bäumen nicht. You don't see the forest because of all the trees. And of course, it means that when we focus so much on the details, we don't see the bigger picture. In the next few minutes, I want to turn it around, because when we talk about health systems functioning, health systems strengthening, our experience is that we actually need to look at the details to understand how the whole system is working and whether it can be improved. In Movendi International, we stand for the most comprehensive approach to tackling alcohol harm. And that means our more than 130 member organizations from more than 50 countries are working with advocacy. They are working with prevention with young people and children. They are working with awareness raising and the discourse about alcohol harm. and they also work around the world with actually helping people that suffer from alcohol harm, alcohol use disorder, and addiction, for example. So really the whole spectrum. We also counteract the alcohol industry and try to protect communities from the unethical practices of the alcohol industry. And we believe that this work, focusing on one aspect of health systems, as Vesna mentioned in her introduction, this work gives us profound insights into how the system is functioning, where the gaps are, where the needs are, and where we and our members are coming in to fill those gaps and respond to those needs. So I want to share 3 examples and 3 conclusions from those examples. In Uganda, our member organization, Hope and Beyond, has been the only organization from civil society providing treatment for people with alcohol use disorder. There are 45 million people living in Uganda, and it's 12% of the male population that actually has an alcohol use disorder. And for the biggest part of the last 5 to 10 years, there was one treatment facility that provided support there. So the health system obviously is very weak for a massive public health issue, alcohol harm in Uganda. In Germany, to go to a high-income country, our member organization provides the only hotline for people to call if they feel they themselves or a loved one has an alcohol use problem. In Germany, 3 million adults are affected by alcohol use disorder. So 3 million people have to call to only one hotline in a high-income country. And we have seen in Germany that throughout the pandemic, calls to the hotline have really skyrocketed. And moving on to Southeast Asia in Sri Lanka, our member organization is working with midwives, training them, helping them to address alcohol use during pregnancy. So really to facilitate prevention work, because as we know, alcohol use during pregnancy is a big public health issue, very often disregarded. And so we believe that these 3 examples, they show how civil society provides actually critical health system capacity, how civil society works to help reach the most marginalized and the most at risk of being left behind, and how civil society can help strengthen and support the health workforce to deliver their job even better. And so in conclusion, for us, we see that civil society plays a key role in improving health workforce capacity to understand and convey essential health messages and health issues. And so we believe that investing in civil society yields lots of returns in doing this work more effectively and actually strengthening health systems. We can also see that civil society increases the reach of the health system. So civil society is really effective in reaching the people that are most at risk of being left behind, even during the current health crisis that we are seeing. So strengthening civil society is not only a purpose in itself, but it has added value in strengthening public health, and it means to really increase the reach of services, the reach of the health system. And lastly, civil society fills gaps and provides critical health system infrastructure. So if we invest in building this, for example, in development partnerships, this can be strengthened, and health justice, health equity can be improved through building these kinds of partnerships. And with this, I hope that we could show a little bit that sometimes zooming into a detail, learning lessons about cross-cutting issues like alcohol, and then zooming out and applying them, a little bit like Josep has said about how to horizontally improve the health system. I hope that this provides some insights for the further discussion. And with this, over to you, Vesna. Thank you.
Thank you, Mike. Thank you for saying that we should focus on the forest and not always only on the trees. Of course, sometimes it's necessary also to look at each tree. But also thank you because you have so well presented how every country can have some missing capacities, and very importantly also how to actually we can go beyond health sector, when we are looking for partnerships in local communities, in particular so when we are addressing such important and difficult challenges as harmful use of alcohol is. But now I think we have come to the point where we will start with our discussion. And before we go to the questions of the audience, I will ask each of you presenters one question, because I don't think the time permits for more. But you are free, if you feel so, to add some view to the question that somebody else was asked. And I will start first with Joseph. Joseph, which are, in your opinion, core characteristics of resilient health systems? You already mentioned it, but please, could you be very explicit and very short? Which are these core characteristics that are actually contributing to the resilience of our health systems?
Thanks, Vesna. Absolutely. We just finished a measure volume we're publishing now, looking at exactly at that. What are the key elements of resilient health systems that shown to be effective during the pandemic? We came up with 20 of those. Don't worry, I won't give you a shopping list of 20 strategies. You're safe. Let me make just a couple of comments. One, half of those are on strengthening governance. Obviously, effective political leadership, that's more difficult. This is what you get after democracy, is not what you choose in moments of crisis, but that's been the most important one, the effective political leadership. But there are elements on the governance system that these leaders have that we can strengthen, we can support. The knowledge transfer, the ability to communicate and transparently with the relevant stakeholders. The involvement has been said already of civil society, of communities, of the health workforce, which have clear evidence has been fundamental, and the coordinating also effectively between ministries and from central to regional level as well, which is the core of today, Vesna, is across our boundaries. These are important key elements on the resilience of the health system in terms of governance. There are elements in financing. Clearly, UHC has proven its value in times of crisis. And in particular, and yesterday we had an excellent session on No One Left Outside initiative about the social support, the access to vulnerable populations which have borne the brunt of the crisis. Like in prior crisis, is these populations that have suffered the most. So UHC and programs to increase access to this population has been fundamental. The workforce, of course, the ability to scale up existing capacity, recruiting additional health workforce workers, and flexible and effective approaches to use them. Here's a lot we can learn from low and middle income countries, and we learn a lot from the crisis. Those countries have managed much better skill mix, shift tasks, have been very effective and very resilient, more resilient to the crisis and indeed to future crises. Public health goes without saying, the appropriate non-pharmaceutical interventions on find, test, trace, isolate, and support. The ability to align these strategies within public health has been fundamental for resilience. And let me repeat it again, and support for isolation. Support is not enough to say you should isolate, it's not enough that you should test and trace. We have to support these vulnerable populations to access to these services and be able to isolate with proper financial aid and housing aid. And finally, needless to say, again, PHC, primary healthcare, has shown its value during the crisis. Those countries with good digital systems and linking primary care with hospital care and a strong primary care, I repeat, have been much more effective during the crisis, as well as their ability to transform their systems, new models, flexibility, double entry for COVID and non-COVID patients, and collaboration with the private sector have been all elements of that delivery that have been actually effective in strengthening, in having better resilience to not only COVID, but hopefully to also to future crises.
Thank you, Joseph. Thank you for sharing this so well with us, where we do need to invest and even innovate to make our systems resilient. And I suppose all this needs to be based on our common values, which is solidarity, equity, quality of care, access, and so on. If we do respect these values and act in all the areas that you mentioned, that is how we are going to get to the resilient systems. It seems quite a big challenge, but as we were talking today, health does matter and is a precondition for any kind of development in the future. So I believe that we will find strength and political will and leadership, as you mentioned it at the beginning, to go step by step in this direction that you mentioned. Is there anybody else from the presenters that would want to add anything? Agnes, please, yes.
Thank you. I totally agree with Joseph, but I want to recall that there is nothing new out of this. The first crisis we faced in Africa was with Ebola. Everybody came saying we need resilient health system to strengthen health system, primary care across the country with support to the people for this not to happen, because the rich countries were afraid that Ebola spreads like it happened in the US. And after the crisis, oops, the new crisis, we say it again. So Vesna, during your presidency, please don't be amnesic and strength to that, so that in 10 years, for the next pandemic or whatever, we are not going to say the same thing. Thank you.
May I come in here, Vesna, very quickly? Agnes, I couldn't agree more with you. And I didn't go into that, but the core of that work we are doing is precisely that. COVID is just another shock that again and again and again has shown the vulnerability and the weaknesses, chronic weaknesses of our health systems, both in this region and elsewhere. And if there's something I dislike to hear, Agnes, is this sentence, let's not waste this crisis. We wasted so many crises that that's the last one we are affording to waste. I totally agree. Much of what I listed was there. We knew about that. And what COVID did is remind us again, we cannot afford to have another one if we don't build on this window of opportunity now for real action within our systems in this region. But much more importantly, the way we work with other countries, we're really dead on the water in terms of sustainability of our societies, not only our health systems. Over.
Yeah, Giuseppe, thank you very much for adding this. And Agnes, yes, exactly. But I do believe that now 7 consecutive presidencies actually are aiming to do something better globally in terms of health. And health systems are a strong component of these endeavors. And there is France after us, and we are thinking of something more strategic globally. And I believe partnership that was mentioned already today is a very important component if we want to succeed with anything globally, I'm speaking, but even within the European Union. But I would anyway ask you, Agnes, do you see any opportunities? You mentioned some, but could you be more explicit? Where are opportunities for us to be more successful in this global cooperation?
Thank you, Vesna. I think I will agree with everything Joseph has done, but this has to be embedded in treaty and multilateralism with accountability. So the opportunity we have here now, because all the world has suffered, and it's the first time all the world has suffered like this. So all the world can understand that. But if we want to change, we need not only to talk, we need not only to put it on writing and sign it, we need to add accountability to that. We need also to reinforce the public sector in countries, because the public sector are the only one that will go nationally. And we need NGOs, but for sustainability and resilience, we need to strengthen system and public one, especially in countries where the people doesn't have enough money to go at will in the private sector. An example exists. There are regional entities like the East African Community that created Center of Excellence to educate local and continental capacity different in different countries, so people doesn't have to go far to be educated. Second, we need to build multilateral organization or strengthen the existing one that understand that we need to leave no one out. We need to serve everyone equitably and keep everyone healthy without leaving no one behind. It's the most important. And we have good example of that. Again, I'm going to give example of African Union, which during this crisis create the African Medical Supply platform that help each and every country to have access to goods to fight and to treat COVID that African countries could not have. Because again, Western manufacturer was not looking at the orders of Africa, even when they were paying in advance. Third, due to the global crisis and collateral multi-sectorial damage in the system, we need to rethink our partnership with support to the continent, with changing the power dynamic between European Union and Africa. Don't go and sit with France and believe and talk about what we need. We have to come and say what we need. That means ownership of country, flexibility, let the country decide on their own plan, respect the principle of the 3 ones, one governance body, one national plan, one monitoring and evaluation plan, and also reinforce the private sector. Because if we want to get out of this spirit of aid, we need to live on our own money. And you can say whatever you want, own money means taxes. And who is paying taxes? The private sector. So reinforce the private sector, but in the same time, support strong social protection based on equity. And we can do that because in Rwanda, it's what we do. We have passed through COVID with resiliency because the health system was created like that since 20 years with social protection, support to people for lockdown, and support for people to who were sick, and support the people to get tested, and bring that across the country. We need also,
yeah. Agnes, sorry to stop you here because I have to give the chance also to other presenters.
Agree. Yes, there's so much to do that we need ideas of everybody.
I can get this, and also I think you answered so well a question from the audience also. They said great points by Agnes that true commitment and partnership from Europe with the global South on eye level is needed. What can concretely be done, they ask, to rebuild trust in that regard? And I think you answered already this, and it is a lot that has to be done.
With accountability.
Accountability also. Okay. So let's go now to Meera. Meera, you had such, as you already said, such good experiences of working together in partnership with EU countries. And I think it's important to know that there are already some good examples. In light of what actually has been said by Agnes and Joseph, do you have anything to add in this regard?
Thank you, Vesna. Yes, what I would like to add is that the European Union actually cannot tell countries how they should organize their healthcare systems, since this is a national competence. However, European Union can provide support for the necessary expertise on the performance of the health systems to build up solid country-specific and cross-country knowledge. This leads to reduction of inequalities in the health systems in the Southeastern Europe region, and helps reduce the impact of the current pandemic, and brings countries of the Western Balkans closer to the European path. So in other words, what is important is to say that we must learn from each other, share the experience. This will reduce the inequalities, and of course, it might reduce also the effects of the crisis.
Thank you, Meera. Thank you, Meera. I will now turn to Mike because we do have a question from the audience, and it says, how can NGOs be institutionally involved in developing partnerships for global health and in the EU efforts in strengthening health. And I had the same question for you, almost the same. I wanted to ask you, how could EU better support such partnerships between the civil society and the public sector in the future? Can you say something on this?
Thank you, Vesna, for your question. And also, I saw the question in the chat. Thank you. I think it's about understanding infrastructure and then development partnerships. So understanding means that health issues like alcohol or the non-communicable diseases as such, we have to understand that they fuel poverty, they are reasons for underdevelopment, and they are causes for migration, which countries like Germany, the EU are caring about. And so we have to work with understanding and mainstreaming these health issues into other policy areas. If that happens, that puts us into a position to create infrastructure. So we would like to work with EuropeAid to devise development partnerships for health promotion. Right now, there are only 2 countries, Sweden and Norway, that invest in development partnerships that tackle alcohol as an obstacle to development, and Norway has even extended that to non-communicable diseases. That number should increase. More countries should fund that kind of work and learn from Norway and Sweden, and EuropeAid should probably be leading the charge. And that can only be done if we also have a platform to discuss these issues with EuropeAid once they have identified what I said, the cross-cutting issues. And lastly, a little bit like Agnes said, we need more domestic resources. And where can domestic resources come from? They come from taxation. And we have to understand that pro-health taxes, like taxing tobacco and alcohol, they are very good sources of revenue to reinvest in health system strengthening and health promotion, and to reduce the burden on the health system that these substances, harmful substances, already are causing. So I think these are the 3 elements that we need for the way forward.
Thank you very much, Mike. Thank you also to be quite short, because we are approaching the end of this session, but there is one question. Let me read it out. I think we already answered this question quite well, but let me see if somebody would like to add something. Considering the currently pledged support by the EU to global health in the context of the COVID-19 pandemic, is it sufficient, and how much of it has already been delivered? I think we have talked quite a lot about this. And then, how can this support kickstart structural partnerships in global health? I'm turning to Giuseppe. Can we add something to what has already been said?
I think we all agree with that question and what's leading there. And clearly we are all behind this idea that any new global health strategy in the EU has to go mostly into global partnerships and strengthen that. But let me repeat a point that to me is fundamental there, and it's already been raised here as well. Member states themselves are part of these global partnerships, as well as the Union. Can we build that critical mass between the programs of member states with the EU partnerships and have a common policy in that regard? I think that's fundamental to give even more bite, even more teeth to these global partnerships. Clearly, the COVID pandemic hopefully has reminded us about the need to invest on that. There's plenty going on. The Monti report on health and sustainable development is very much suggesting new approaches to these structural partnerships in global health. There are lots of proposals there. There's commitment of the Union, there's commitment of the G20, there's commitment of the emerging international organizations. If it doesn't happen now, I'm not sure it's never going to happen, really. Over to you.
Can I say something?
Yes, but you will have to be very short.
Very short. Just say there is expertise on the continent on how to build a resilient health system. So don't bring people from outside, you will pay a lot. Second, Don't forget that, Mark, don't go to the European Union to discuss what you have to do in Africa. Go in Africa, discuss, and go with the African to the European Union. If not, it's again colonialism, etc. So thank you. But I agree with all of you.
Thank you very much, Agnes, for these last words. I'm not going to repeat it because they were very strong. We could finish the session here, but anyway, I will finish officially the session by thanking the presenters for providing a very clear picture how we could best work together and for pointing to opportunities we could seize in the future. I would also like to thank the audience for the questions and being here with us. Strong, resilient health systems and reaching out in the community are some of the guarantees that nobody will be left behind and will have access to best possible care and preventive services. We can come to that working together globally in this regard, and this will bring us faster also to the other aims of development that we have all agreed upon. Let us, however, never forget about the forest, as Mike said, when we are discussing the trees. And here I will thank again to organizers and everyone present at the session. And this is actually the end of this session. Thank you very much. And goodbye.
Thank you very much.
Thank you
very much.